Okay guys, today we're going to be doing denture care. So my first 5 steps are going to be knock, identify, explain, privacy, and hand hygiene. Okay, so now I can go ahead and raise my bed rails. And for this skill, my patient is going to be in a Fowler's position. So, thank you. High Fowler's. So I want them completely sitting up. You can be doing both at the same time. You can raise their head and raise the bed at the same time. Okay, so before I would lower this rail, I'm going to move my table. So for this skill, your basin is going to act as your sink, okay? And we're gonna pretend that our sink is positioned right next to our patient. So I don't have to do anything with the rails, my sink's right here, okay? So I'm gonna lower this rail. This is my sink. The first thing that I'm going to do is line my sink with a towel. Okay, we do this and it's really important because dentures are very fragile. So if I were to accidentally drop them in the sink, that way they're not gonna crack. Because this is not filled with water, it's just a running sink. They're not gonna crack. And then B, if it were a partial or a smaller denture or anything like that, if I were to drop it, there's no chance of it going into the drain. Okay, so I've lined that. Your dentures on the day of testing will be just sitting out somewhere, okay? There are dentures inside of the patient's mouth, but most testing centers don't use those ones because they're difficult to pull out. So they'll just have dentures sitting somewhere for you to pretend to take out. Okay, so my sink is lined, and I'm going to place my waterproof pad. So what would I need to do right before I did that? So now I'm gonna put my gloves on. And I'm going to place this waterproof pad just right here just to protect their clothing. Okay. I've got a gauze here, and with this gauze I'm going to ask the patient if they would like me to remove their dentures for them, and they said yes they would. So using my gauze, I'll just hold these dentures up and pretend to remove them. And to take out the top one, I'm going to kind of wiggle back and forth because sometimes we've got that denture glue or anything in there. Wiggle back and forth to loosen them and then pull down. As soon as I have that out, it's going into my kidney basin. And then same thing for the bottoms. I'm just going to kind of wiggle back and forth and pull up. Okay, so now that I've got the dentures out, they go straight into the kidney basin. I've got running water in this sink, so I'm going to start with a toothbrush and toothpaste. And I'm going to pick up my first denture and begin cleaning it. The important part here is that your evaluator see that you're cleaning all areas of the denture. So you're cleaning not only the teeth, but inside the top of the denture, the roof of the denture, you're cleaning it in its entirety. And at some point you need to verbalize to your evaluator that you are doing this with warm to cool water. Okay, so I've got warm to cool water running, never hot and never cold. And then I can just rinse this off. This kidney basin is dirty because I placed my dirty dentures in there. So once this denture is clean, it's going into the denture cup. Okay, that's a clean denture cup. And then same thing, I'm gonna add toothpaste. And I'm gonna take my second one over here and clean the denture in its entirety, getting the teeth and then every other part of it. And making sure if there's any glue or anything like that on there that I'm really scrubbing them and getting them good. Okay. And then I'm gonna, again, rinse that, and this is gonna be placed into the denture cup. And I'm gonna fill this denture cup warm to cool water. Okay, so now I'm gonna come over here. I'm gonna rinse my kidney basin so that it's once again clean. And I'm gonna take a mouth swab. I've just got one. I'm getting it wet and I'm gonna dip, squeeze, check, just like for unconscious mouth care. And I'm gonna come and just clean my patient's roof of their mouth, their cheeks, and their tongue. Once I've done that, then I've got my mouthwash, and I'm just gonna give them some mouthwash, pretend they're doing that, and they're gonna spit that into my kidney basin. And then this can be dumped and again cleaned. And then my last step, I've got my clean dentures in here with warm to cool water, and I'm gonna ask my patient if they would like me to place their dentures back for them. And for this skill, we're just gonna say they don't want them back in, it's bedtime, whatever it is. So I'm going to store these in the bedside table. So I'll just stick these over here, and now that part's completely done. So now I can remove my waterproof pad, my washcloth. I can remove these gloves. I'll verbalize to the evaluator that my area and all my everything's been cleaned up and stored. I can put my patient back down to a comfortable position. You can do the head and lowering the bed at the same time for this one. And I'm going to lower them completely down. Okay, once they're to the floor, I can lower my bed rails. Make sure my bed looks decently straight. And then what are my last 3 steps? Call light, hand hygiene, report and record.